From our 22 News Broadcast Center, this is 22 News in Focus.
Welcome to 22 News in Focus. I'm Don Schiffman. The COVID-19 pandemic has created a lot of stress for all of us. Fear and anxiety about this disease and the lack of uncertainty, or certainty there is, I should say, about the future is really overwhelming and can cause strong emotions in adults and children. Public health actions such as social distancing can make people feel isolated and lonely and can increase stress and anxiety. So today on 22 News in Focus, we are talking about the growing mental health crisis due to COVID-19. Today with Kimberly Lee, Vice President and Resource Development and Branding for the Mental Health Association. I want to thank you for coming on the program.
You're very welcome. Thank you for having me.
So what are you hearing from your clinicians and your colleagues in the mental health field in our region concerning all of this?
Well, I would say that certainly locally we are seeing a higher demand for support from those who are experiencing emotional distress in a variety of forms. That might include anxiety, distress, depression, high degrees of uncertainty, fear, and worry. But it's important to note that these feelings are not unique to our region. Nationally, even internationally, mental health professionals are reporting increased levels of stress and anxiety in particular. In fact, it was a recent poll by the Centers for Disease Control, which indicates 48% of Americans are anxious about the possibility of contracting COVID. 59% feel COVID is having a serious impact on their day-to-day lives, and 2/3 of Americans are fearful that COVID will have a negative and long-lasting impact on the economy, but more specifically, on their own personal finances.
Are you seeing an increase in demand for services? And I would assume everything is being done similar to what we're doing right here over Skype or Zoom.
MHA really had the foresight several months ago, even before the COVID pandemic hit, to adopt a Telehealth service through our Best Life Emotional Health and Wellness Center. So Telehealth is an application that allows individuals to conduct live therapy sessions with a licensed clinician remotely or virtually. So individuals just download very quickly the app, the Telehealth app, and which is just a very quick 2-step process. And they can have conversations, they can conduct their therapy, again, virtually through the comfort or in the comfort of their own home, perhaps a break room at work, in the front seat of their car while they're commuting to work. But telehealth has really given MHA the opportunity to see people where they are and where it's most convenient for them without there having to be an in-person contact or appointment in an office. So it's really been a tremendous benefit during COVID for individuals who have needed those additional supports.
And are you seeing a specific demographic, for example, or is it, across the social spectrum the same?
It really has been across the social spectrum, but I will say that research informs us that for individuals who are severely low income, COVID will potentially have a disproportionate impact. In fact, it was a newly released report entitled Forecasting Poverty Rates During the COVID Crisis, which was released by Center on Poverty and Social Policy from Columbia University, which indicated poverty rates in the United States could reach its highest in 50 years because of COVID. And here's what we know. If unemployment rates continue to skyrocket, an increase of more than 21 million individuals could live in poverty alone this year. These projections are even worse for people of color and for children. Children who we know are at a considerable disadvantage developmentally would see their poverty rates actually rise by 53%. So certainly we are seeing mental health concerns across all social spectrums, but COVID has really hit harder in the Black and Latino communities.
And I would suspect this too, because, how does something like this type of stress that everyone's dealing with right now because of COVID-19, how is it impacting people who are already dealing with a mental health issue?
Well, it can exasperate a pre-existing diagnosis for sure, because while Telewell is a wonderful resource which is easy to use and a modality which allows people to access their treatment without the barriers of transportation or for concerns for face-to-face dialogue or counseling sessions, not everyone is comfortable with virtual therapy, nor does everyone have the technology that's required to use it. There's been a lot of conversations as of late around the digital divide. So that, coupled with limited access to in-person clinicians for those who already have a pre-existing mental health condition, the individuals could theoretically, potentially be going without the much needed therapies that they need. But mental health issues often coincide with a unique set of challenges that make it difficult for people to access even the most basic necessities. So things like food or medications, stable housing, healthcare. Without the right supports, somebody with a severe mental illness often struggles making ends meet, getting the resources that they need, being able to take care of their medical issues, having enough income to sustain their daily needs.
I want to talk about how we can help our children during this national health crisis. Once we return, we'll continue our conversation. You're watching 22 News in Focus.